Hi, this is John Barker, and I want to speak directly to all Oregon chiropractors. We are introducing the Happy Brain Concussion Care Program with a provider certification with Dr. Todd Turnbull and myself, and it is something that we have put together very specifically to help every single chiropractor in the state of Oregon. First off, my name is John Barker, and I'm the managing partner of WMC Business Services, LLC. We're an employee benefits and risk management firm. But more importantly, we promote chiropractic care to help reduce costs for our clients, both for themselves, their employees, and their employees' families. We teach how to use chiropractic care from a wellness and prevention standpoint and even a recovery standpoint for health insurance and workers' compensation. But the problem we're running into is even though these numbers are fantastic and they show all of the different things that can happen, there is bias out there. There is hatred of the chiropractic profession, both from their carrier standpoint as well as from the employer standpoint with decision makers, and that's what we've been having a battle trying to get through to these individuals. And if the individual who makes a decision won't allow this in, then we can't get down to all of the employees. What's strange about this is the employers' costs keep rising, the employees' costs keep rising, carrier profits keep going up, but they're not doing anything different. Well, what has been working is this. Over the last few months, as I've been speaking and talking about this while we're getting the Happy Brain Concussion Care Program up and running, I have been going into corporate America. I've been going in at a boardroom, and I've been showing the little self-test to individuals, even those who have a bias against chiropractic care. We didn't tell them they needed a chiropractor to see this, but I showed them a need. The last place that I went into, there were 4 people in the boardroom, one person in their late 20s, one in their 30s, one in their 40s, and then myself. All 4 people test positive for mild traumatic brain injury at some level. 1 at a level 1, 1 at a level 3, and 2 at a level 4. That's been very effective to get them to understand. And then we have been teaching some things about unique workers' compensation control programs utilizing chiropractors. That's been working. So here's our goal. We want every single chiropractor in the state of Oregon to become a Happy Brain Concussion Care certified provider. And that doesn't mean they're going to be a concussion care specialist. That's a 300-hour course. This is just a 3-hour course, but there are a number of things that this program with Dr. Turnbull can do for most of the people with mild traumatic brain injuries. But we want every single chiropractor to be certified for a very important reason, and I'll go through all of that. Because it's going to provide new opportunities for every DC in the state. And we want to enhance the public and corporate perceptions of chiropractic care to the general public throughout the state of Oregon. So first off, a number of different providers can be part of the Happy Brain Concussion Care Program. Generally, anybody who can touch a patient can do this. Now, chiropractors, we want to be on the forefront because in your training to become a chiropractor, instead of just spinal manipulations and things of that nature, you have neurological training, and that's where this comes into. That might not be the major part of what you do in your practice, but that's still something you have in your past. Now, osteopaths, medical doctors, naturopaths, possibly even physicians' assistants and registered nurses could do a diagnosis. In other words, once they do the initial test to see if they might have it, then to do the full test to make sure they're diagnosed. Those are the individuals who can do it. Acupuncturists, massage therapists, physical therapists, and occupational therapists, and others could do the physical manipulations because it's trauma-free. There's no thrust movements whatsoever. It's very gentle and stretching and things of that nature. They can do the actual performing of the treatments, but they cannot do the diagnosis. So that's where it leads to some telemedicine capabilities. This can be done on a telemedicine basis where a chiropractor anywhere in the state can talk to somebody else within the state, let them know if they do the diagnostic test, and then somebody in that community who may be a massage therapist or something could do the work. So that lends itself to getting your practice outside of your general neighborhood and into other areas of the state. So first off, the goal of this is if we're getting blocked out from having chiropractors see. Now, in the email template that I send out, there's a little video that says a doctor chiropractor in Florida, why are chiropractors only seeing 8 to 15% of the general population? It's due to fear, misinformation, whatever it is out there. Why is that? So what we're trying to do is change that. Once you get somebody in your office, no matter what it's for, and if it's for happy brain concussion care, then that is an opportunity to teach them everything else you do: prevention and wellness, pain management, nutrition, the chiropractic manipulations, whatever else you do in your office. It's much easier to do that with the patients that's sitting there for another reason, like the Happy Brain Concussion Care Program, than it is to try to get them into your office on that first initial time. Then we can start to go into companies and teach them how a long-term strategy can be to their benefit using a chiropractor. Now, my staff, some of these are marketing people, some of these are wellness specialists, but this is part of my staff, and we are doing the marketing for this program. Locally, statewide, nationally, all of that. There's a big, we're going after this on a national and then international scale. The Happy Brain Concussion Care Program, like I said, does not make you a concussion care specialist with that 300-hour course for chiropractors. What it does is it certifies you in Dr. Turnbull's trauma-free treatment protocols. Now, in his 30 years of practice, about 70% of the people who have some mild traumatic brain injury can be helped by the Happy Brain Concussion Care Program. If by chance that other 30% cannot be helped, that is where we refer to the true specialists who have taken that 300 hours of classes to be able to assist. But what about those 70% that don't know anything about it, don't even know that they have it? That's what we're trying to accomplish. So in this situation, what we want to take a look at is we want every single chiropractor, either in just their local communities or even on a telemedicine basis, be able to assist in diagnosing anyone anywhere in the state of Oregon, and if you're licensed in other states, in the states that you're licensed in. What we would want to do is then make sure to partner with local acupuncturists, massage therapists, physical therapists, occupational therapists, even in rural communities, to let them know to be able to direct people to you. Now, you may be able to do the diagnosis. They will do the actual treatments if they are found to have mild traumatic brain injury, but that's still, even on a telemedicine basis, they're a client of yours, or a patient of yours. How can you then teach them from a distance nutrition, pain management, other things, and if it's not too far of a distance, could they travel to see you for additional resources that the other practitioners cannot do? This is a tool to open up many, many doors. So what are we doing? We're taking this out, and now the videos that you see emphasize children first. If corporate America doesn't want to take this out to their employees, we're going to take it out to where parents can see this for their children. And at the same time, we're going to teach parents that they have this issue too, and they need to be treated, and work our way up into corporate America, into organizations, schools, organizations, businesses, through a grassroots effort to go help the children, help their parents, and then when they see some results, tell people within their organization about it so they will want this in their organization. So anything to do with sports activities, businesses, schools, you name it, we're going there. Now, this is just something I've done recently in the last 2 days. We've contacted the Trailblazers, the Portland Timbers, the Oregon State PTA, the Oregon State Youth Soccer Association, and the Archdiocese of Portland. What we're doing is getting the message out there to as many people as possible to say this is out there, this is real, and we are building a provider network to be able to take care of this. So I've been in contact with the Oregon Education Benefit Board, the Public Education Benefit Board. Will be taking this out to cities, counties, states, and local businesses in the Portland and Oregon areas. But more importantly, this is why we want there to be a major focus nationally on Oregon and on Oregon chiropractors. Dr. Turnbull is here. Dr. Turnbull can do more in the state of Oregon to build this program into a national and international program, but we need the providers. We want every single Oregon chiropractor to benefit from this. So when we go out to larger companies, Lowe's, Home Depot, Amazon, Federal Express, Swift, all of these large companies, what we're going to be telling them is we don't know how many of their employees have issues with mild traumatic brain injury. Generally, 15% of the population and more. But in a workforce, if they do physical labor, if they're in a very physical capacity, or if they're very active, that could go higher. We want to say that we're building out the main part of this network first, and we want to test this program, the Happy Brain Concussion Care Program, and other cost containment protocols with their employees in the state of Oregon first. So let's just say Lowe's or Home Depot. If you've got a Lowe's or Home Depot anywhere close to you, you could become the Happy Brain Concussion Care Specialist to go in to 150, 250 employees, do the work for the concussion care, and then you have an opportunity to start teaching them. And when we get results, when we start showing those results, we then will want to take that out and interpolate that through their 300 to 1,000 employees, and if it's Walmart, their 1,000,000 employees. That's what we're trying to do. And we're going to contact every Fortune 500 company in America and tell them we want to test to get their numbers to see how this can then roll out on a national basis, but all the testing needs to be done in the state of Oregon. This is where all of our marketing efforts are going to go. So here, this is just the size of the state of Oregon. This is not the Teachers Association, but this is just the public employees and the colleges. There's about 82,000 employees. If there's 15%, depending upon how many have the high or low, we could save them $4 million. And when you look at the case study that I sent, that Dr. Turnbull did with the 72-year-old woman, look at the improvement this woman did in 4 weeks. Not the 4 to 7 years that the other study did, 4 weeks. We can start to show them in a short order how much we can save them for large companies, large organizations, and eventually into healthcare systems to be able to do this. That's our goal. Once we do this and we show these results, how do we take it into a health insurance platform and they rent our network. They want our certified providers to be able to assist in reducing costs. So now, what if there's more of those individuals and the ratio of severity is the same? We can even save them more. Now, if there's even more, but the ratio of some with high level, we don't know these numbers. That's what we need to be able to do the testing for, especially with the large companies, and that's what I'll be taking to corporate America. So just look in the state of Oregon. There's 4,143,000 people. If there's only 15% right now who have mild traumatic brain injury and they don't know it, that's 621,000 people we need to help. That's not the new cases that'll come up because of activities and things. That is what is there right now that we need to help. We need providers in every community, and we hope that this provider list will have more chiropractors in it than anything else. That's what we want to be able to do. In fact, Dr. Turnbull, normally there's a $500 fee to do the certification. That pays for 2 websites. One, the free website for parents and adults to be able to do the testing and find you, and the other is a support website for all the providers, and then the marketing. Dr. Turnbull is waiving all of his fees for Oregon chiropractors. So instead of $500, it'll just be $250, and that is for the marketing efforts to go out after these Fortune 500 companies, all these companies, and the social media, the press releases, and everything else that's going to be associated with that. What we are trying to do is to open doors for Oregon chiropractors because we're going to teach them how to reduce health care costs, health insurance premiums, and workers' compensation and premiums. Every DC in Oregon, we hope, will become a certified provider on the Happy Brain Concussion Care Program. And for those who want to, as we get into these organizations and do more testing, we'll be doing the placement not just for the Happy Brain Concussion Care Program, but for everything we do to lower health insurance premiums, lower health insurance costs, and workers' compensation premiums and costs associated with workers' compensation. So as you get on this provider, if I'm working in your community, like right now we're blitzing Hood River and the Dalles as well as the Portland metro area for 2 DCs that are already signed up. As we go into your community, just let me know that you would like to expand your practice and go into these organizations, not just as the Happy Brain Concussion Care certified provider, but as a specialist in reducing costs in other areas as well. Please contact me with any information, but I do want to implore you, please consider every single chiropractor in the state of Oregon to become a certified provider so we can make a difference, both first in the state of Oregon, but nationally and then eventually internationally to take care of an issue that's not being taken care of at the present time.